Hi there. My name is Dr. Peter Hsin. I am a psychiatrist, and I'm going to talk about medical billing. So when I first joined Dr. Dunkus for private practice, he was using a local billing company that was kind of expensive. They weren't using cloud software, so there was a lot of faxing back and forth, and it was kind of expensive. So I convinced him to bring billing in-house. I trained the office manager how to do billing. We used some software, and it was working okay. But then, our office manager doing the billing wanted a raise, and I gave her a raise, and then she asked for another raise, and I gave her another raise, and then she asked for another raise. And I could see that this was getting too expensive. And so the other thing was, I didn't have the time or energy to supervise her. So the next option I went with was we switched to a national billing company that also provided our EHR, and they offered a pretty good rate, and it was a good deal, except, even though they were supposed to be like an end-to-end revenue cycle management, they didn't take care of all the billing things they were supposed to. And it made sense. The mathematics of it is pretty straightforward. For the percentage that they took, it's very profitable for them to collect on the claims that just go through fine. But when a claim is rejected or there's some sort of issue, and someone has to take the time to fix it, call the insurance company, whatnot, it wasn't worth it to them to fix the problem. But it was worth it to me to try to fix a problem when a claim didn't go through. And so I hired someone separate to basically catch their mistakes, fix the claims that were rejected, and so on. And this is where the person behind ZEE Medical Billing comes in. That's the person I hired. Now, if you outsource your billing and you hire someone to do billing, you don't have an ideal solution. So it was not an ideal solution, but I lived with it for a while. And eventually the billing company was making more and more mistakes. They had these software errors that caused these phantom credits and payments to appear, which are obviously in their favor. And they were becoming less and less responsive when we would point out things they were supposed to be doing and they're not doing. And so eventually, ZEE was asking me, why don't you just let me take over the billing? And so eventually I'm like, okay, go ahead, ZEE, take over the billing. And this solves the fundamental problem of billing for anyone. And the fundamental problem of billing is this. If you have it in-house, no one wants to do the work. It's expensive to use local people. It's frustrating work. It's costly, and who wants to supervise people? And then when we outsource, they take a percentage of revenue, and no matter what percentage of revenue they're taking, whether it's the low end or higher end, ultimately it's not worth it to them to follow up on the harder claims, even though it's worth it to me. It's worth it to the provider. And this is where, with ZEE, we have the answer, and the answer is integrity. I trust him. He does what he's supposed to do. It's his job to take care of billing. It's his job to call the insurance company. It's his job to figure out what needs to be done, and so he does it. And so, yeah, I've been very happy with my experience. I'm happy with my relationship. And that's my story with billing. It ends here. Okay. That's my 2 cents.